Hello, good afternoon. My name is Dr. Chudi Ufundu, and today is another important clinic, another important episode in Open Clinic with Dr. Chudi on YouTube. So, thank you and welcome to today's event. Today, we're going to look at cervical cerclage. What's cervical cerclage? Who needs cervical cerclage? What are the pertinent questions? What are the pertinent reasons? What's the procedure? Are you supposed to be afraid? These are the things we should talk about in the next 30 minutes. Now, this particular topic, it's highly recommended to all pregnant women because the need for cervical cerclage might present before you become pregnant. Or you might have had some history before pregnancy that might warrant going for cervical cerclage. So it's an important topic, it's an important concern. This particular procedure might be the bridge over troubled water that will make you a mother. So I want everybody in attendance, when you come in, introduce your name. I'm going to start. After my presentation, you have opportunity to ask all your questions. So we're talking about cervical cerclage. And I'm also going to use my amazing teaching model to demonstrate everything we're going to talk about today. So I'm actually going to start. When you come in, you just join me and give me some time. After my presentation, you will ask your questions. So first of all, we have to identify the cervix. So the cervix is the junction between the vagina. So this is the vagina, okay? And the womb. So it's a very important junction. So where my pen is settling, it's actually where the cervix is located. Very important point in successful pregnancy. There are a couple of periods we want the cervix to either be open or closed. Before pregnancy, we want the cervix to be open so that the semen can come in. So at the peak of sexual intercourse, your partner will ejaculate and deposit the semen. Remember, the semen is the fluid you can see visibly, but the sperm is contained inside the semen. The cervix needs to open so that the semen can come in. The cervix actually has a nourishment media that helps the sperm to thrive. Now, once pregnancy has been confirmed, we want the cervix to be completely closed. Anything that affects the integrity of the cervix might likely lead to poor outcome in that pregnancy. Now that comes to the point of today's lecture. So what's cervical cerclage? So cervical cerclage is a special procedure, a special surgical procedure. Only a doctor should conduct this. This procedure is used in closing the cervix during pregnancy, bridging the cervix. And prior to this, we might have had some concerns that the cervix is weakened or the cervix is incompetent. So when the cervix is weakened or incompetent or insufficient, that's when we have to go and secure the cervix. Now, I want you to see your cervix like a pouch or a purse. When the purse is open, coins and documents can fall out from the purse. When the purse is closed, nothing can fall out. So I want you to picture the cervix like a pouch or a purse. So the aim of cervical cerclage is to put some sutures around the cervix to secure the cervix so that your baby will not likely be born before 37 weeks. So cervical cerclage is used in situations where we suspect that the cervix is weak, where we suspect that the woman might likely have her delivery before 37 weeks. It keeps the unborn baby safe inside the womb. So when we are putting the sutures there, we are making sure that the purse is closed so that the baby cannot escape before time. By standard, all pregnant women are meant to carry their baby up to 37 weeks. When your pregnancy gets to 37 weeks, it's called term. This is critical because when you get to term, it's assumed that the baby's important organs would have been fully formed. So if your baby decides to come from 38 weeks, 39, 40, remember the peak is 42. Your baby can be assessed, we can assess you and send you home. But if your baby comes before 37 weeks, your baby will be classified as preterm or premature baby, and we'll send the baby back to the neonatal intensive care unit before we send both of you home. So during this procedure of cerclage, we will place several sutures around the cervix to secure the cervix. I've already defined the anatomy of the cervix. Now, why is cervical cerclage performed? There are two important reasons why we will perform cervical cerclage. I've already mentioned the first one: incompetent cervix, weakened cervix, insufficient cervix. Now, this might be due to past surgeries. So some women might have a need for some cells to be removed from the cervix. If we suspect they might have cervical cancer, so they can go for a procedure we call LEAP. Or they might have had some procedures done in the past that affected the integrity of the cervix. If you've had any surgery in the past, when you're pregnant, when we are asking you questions, please oblige the questions. Give us the feedbacks. We need to know about your myomectomy. We need to know about your CS. We need to know about your polypectomy. We need to know about all the procedures you've done in the past, because they can affect the outcome of that pregnancy. They can affect the integrity of the cervix. So women that have had LEAP, which is a procedure of collecting cells or removing cells from the cervix, if we suspect they might be cancer, they might be predisposed to having insufficient cervix, incompetent cervix, weakened cervix. So this is the major reason for using cervical cerclage. Another reason for using cervical cerclage is in women that have had previous miscarriages due to abnormality in the womb or damage to the cervix. So if you've been having 4 miscarriages in the past, remember, miscarriage is the unintended loss of your pregnancy before 20 weeks. If you lose your pregnancy beyond 20 weeks, it's called stillbirth. So we don't want anybody losing their pregnancy. So if you've had 3 pregnancies, 2 pregnancies, 4 pregnancies in the past, got miscarried, you might be a good candidate for preventive cerclage. Now, cerclage can be abdominal cerclage or transvaginal cerclage. Your provider will decide the type you will need. So past miscarriages might also be an indication for cervical cerclage. So it's important you discuss all your history with your doctor. This is why we make it compulsory for all pregnant women to present to a qualified OBGYN to register for your ANC on time, because becoming pregnant is not the ultimate aim. The ultimate aim is delivering your baby. Anybody can become pregnant, but we don't just want you to become pregnant. We want you to become pregnant and have your baby. So if your doctor thinks you might need cervical cerclage, the best time to administer cervical cerclage is about the 12 to 14 week. Why should we do it about this time? You see, as you are pregnant, your pregnancy is proceeding, the layer of the cervix will start thinning down. So we need to act fast before it will be too late. So if you are currently pregnant and your provider recommended cerclage, if it's not preventive cerclage, that cerclage must be administered before 12 to 14 weeks. That's the best time to go for cervical cerclage. Now, what will happen before you go for cervical cerclage? Definitely, we have to ask you a lot of questions, get your history, discuss with you, talk about the past complications, tell you the reason why we are doing this. Then you understand it properly. When we are done doing that, then we are going to examine your cervix. What's the best position to examine your cervix? You're going to lie on a hospital examination bed. You're going to hang your 2 legs up in a stirrup so we can have a clear view of the cervix. So we examine your cervix by placing what we call a speculum. So speculum will be passed through the vagina so we can see the cervix clearly and make sure we understand what we are doing. By the time we are done with passing the speculum and examining, then most times we can also take a transvaginal ultrasound to have an overview on this. Now, before then, this is something that all women must abide by. You have to abstain from sexual intercourse 10 days before the procedure. 10 days, no sex before the procedure. After the procedure, another 10 days before initiating sex. So no sex 10 days, no sex after, abstain completely. Now, it's okay to feel nervous and worried when you're going for this, but you're completely gonna be fine. It's an outpatient procedure. The essence of doing it is to make sure your baby has a good chance. So during this time, ask your provider all the questions you need to ask. Don't be afraid, but ask your question. So what will happen during the cervical cerclage? Like I explained, we're going to take your history, we're going to examine you, take an ultrasound, then you lie on your back on the examining table with your legs open and feet hanging out so we can have a clearer view. Now, your doctor will give you some pain numbing medication because anytime we have access to the vagina, it's very, very sensitive. It can cause pain. It can cause discomfort. So this is a procedure we are doing because we're going to put sutures there. So we give you local anesthesia. Local anesthesia is a drug we will give you to numb the whole of that area so that you will not feel pain. When we are done doing this, it's okay to feel some discomfort, some pain, some spotting, some bleeding shortly after this procedure. Once we have a good look, we are going to put the sutures. We'll carefully put the sutures, then we give you instructions on what you need to do. Now, some people will be wondering, is cervical cerclage painful? By default, anytime you're going to the vagina, anything you put out there except the penis can cause pain. But the pain you will feel when we are done with this will be, same pain you will feel when you're having your period. It's okay to have discharge. It's okay to have spotting a few days after this. You should not feel more pain than your normal period. If you begin to feel excessive pain, then you need to ring your doctor immediately. You will also take some painkillers, very safe painkillers, like your paracetamol, your Tylenol, and you're very good. But please, if you notice that after this procedure, you are bleeding heavily, call your doctor immediately. Now, what happens after this procedure? You're going to get home. It's a day case. So you go home, we just monitor you for a few hours to make sure you're stable. Then we send you home. We'll tell you to abstain from any domestic chores, no school, no work that day. Now, we want you to have plenty time to recover. So we'll allow you 10 days of abstaining from sex, of abstaining from sports, of abstaining from stress. 3 S's: sex, sports, stress. This is the same thing we want you to do anytime you notice bleeding. So you observe this. When you are fully healed, then you can begin to engage in all the activities you need to engage in. So you can go to work the following day, but you need to be careful so you don't make love for 10 days. Please be careful. What are the advantages of cervical cerclage? We've already mentioned it. We want to keep your baby good so that your baby will get up to 37 weeks. This is the biggest advantage and the biggest reason why we are doing the cervical cerclage. So what are the risk factors? Remember, anytime we are gaining access into anybody, anytime we are conducting any procedures, there are things that will happen, likely. So first of all, infection can happen. We can have damage to the cervix, you can bleed, you can have premature rupture of the water membrane, you can go into preterm labor. So it's important you go to a professional. It's important you go to a facility that if we notice any complication, we'll begin to intervene immediately. In some fewer cases, you can subsequently have what we call cervical stenosis or scar tissue. Or in some women, in course of doing this, they will go into frank labor. But this is very, very rare. Now, what are the things you should do or you should not do after the cervical cerclage? Definitely no sex, no sports, no stress for 10 days. After you're done with this, you can resume your normal activity. But go easy. Go easy. Go easy within that first 10 days. When you go easy, you will be fine. Is it okay to have sex after 10 days? Completely okay. Once the 10 days have passed and you're completely fine, you can resume your sexual activity. Can you go back to school after the cervical procedure the following day, definitely you can return to your normal activity the following day, but no sex, no stress, no sex, okay? No sports. Please be careful. Now, when should the cervical cerclage be removed? When we have achieved our aim, which is 37 weeks. So every woman in our gathering, when you are pregnant, I want you to go and write 37 weeks somewhere. Once you get to 37 weeks, we are good. So the time target for removing the cervical cerclage is 37 weeks. So we want the cerclage to stay until pregnancy reaches term, about 37 weeks. When that time comes, you will still present yourself to your doctor's room, and exactly what I told you about before putting it is exactly what we're going to observe. So you lie on your back, you raise your two legs up in a stirrup, we examine, we go there and carefully remove the sutures. Once we are done removing the sutures, remember, when your baby is good to go, when your baby is about to come, the cervix will relax, the cervix will soften, the cervix will start opening so that your baby will come out. So when we do this, about the 37 weeks, the cervix is already getting ready to deliver the baby. Once we are done removing the sutures, you're good to go. Your baby can come anytime. Okay, so this in a nutshell, it's what cervical cerclage is all about. Now, I'm going to open the clinic, and I'll give you an opportunity to ask your questions. I want everybody in attendance today to ask at least 5 questions. You see, there are important steps you need to take as a mother. There are important preventive steps you need to take as a mother. There are important knowledge you need to imbibe as a mother. I'm looking at the numbers very abysmally poor. And I know there are so many women that will benefit from this. But it's okay. So if you're in attendance this evening, please go ahead and start asking your questions. I want everybody to ask their questions in real time. If your questions are not seen, you can ask again. I haven't seen any question. I can see my COO. I can see Dr. Ndiche. I can see Chinyere. I can see Tosin. Just the normal people that show up every day. But please ask your questions in real time. If you're planning for this procedure, no need to worry. You're a mother. So equip yourself with the right knowledge, have the best attitude, have the best practices, have the best perception. Make sure you are under the care of a very good doctor. Any good doctor can take care of cervical cerclage, okay? Thank you, Doc. Please, what's the success rate? Very, very successful. Matter of fact, about 87% of women that will have their cervical cerclage would have prevented the baby from coming early. So if you don't put it when you need it, you're going to lose your baby. That's as simple as that. If you have incompetent cervix, it's not a case of sentiments or crying or pity or praying. You need to put the cerclage. Matter of fact, there are some women who need to give abdominal cerclage ahead on time. But you have to wear this cerclage within 12 to 14 weeks. The opposite of not wearing it is losing your baby before 37 weeks. Now, some babies can be born around 26 weeks. My daughter was born at 26 weeks. If you have the facilities and if God is on your side, the baby will be fine. But why should we take chances? Okay? All right. So please keep asking your questions. What are the signs that someone may need cerclage? Perfect question from my amazing admin. So here's the deal. Remember, if you go for your routine checks with your provider, so you would have gone for your well woman check. And if you're in a category of believing for baby mothers, right? Would have done a couple of checks, would have done ultrasound, would have checked your cervix, would have noticed some changes. Now, some women, one of the signs that will tell us you might likely need cerclage is what? Shortening of your cervix. There are expected length of the cervix. When your cervix is shortening, when we notice some changes in your cervix, that might give us a signal that you might likely have cervical incompetence, then we go into action. Cervical cerclage is a preventive measure. So when you regularly come in for your checks, every woman that wants to become pregnant is encouraged to go for preconception visit. So we need to conduct investigations, do examination, run an ultrasound, keep an eye on the cervix. So if you've had series of miscarriage in the past, and we keep wondering what's going on. We gave you progesterone, we supported everything. Then we notice that your cervix is short. Your cervix is thinning down. We're not going to waste time. We're going to put the Cycloads to prevent the repeat of miscarriage. Very lovely question. I love that. Will a woman continue to need Cycloads with subsequent pregnancies? Positive. If you've had Cycloads in one pregnancy and you succeeded, unfortunately, listen to me, my people, there are some women that will have Cycloads and unfortunately they will still lose the baby. So the good outcome is to have Cycloads and have your baby. The possibility of having Cycloads in subsequent pregnancies is almost 99%. Though we are going to treat each pregnancy as different. But if you've had Cycloads in the past, subsequent pregnancies, for us to have peace of mind, we'll give you another Cycloads. I love that question. Amazing question coming from my crew. I'm so proud of you guys. Are there things a woman can do by herself to make her cervix stronger? Another important question from Kenneth. So here's the deal. You see, by default, if you live healthy, if you eat healthy, if you exercise, if you're mindful of the sexual partners you have, now your body will function the way God made it. Okay? So talking about strength of the cervix, when you drink a lot of water, when you observe your personal hygiene, when you go for your well woman check, then importantly, when you're exercising, there is a form of exercise we call Kegel exercise, pelvic floor exercise. You should go and read it up. This is a form of exercise that strengthens your pelvic floor muscles. So if you're a fit lady, if you're well, if you are staying active, the possibility you will translate those activity to your cervix, it's high. So staying active, knowing how to conduct your Kegel exercise to an extent will give strength to your cervix. Now, some women might do all these things and their cervix will still be incompetent. So the key word is to know your history. The key word is to have a very experienced provider that will intervene. So how do we know? How are we going to know? You have to present to the clinic. We have to have our suspicion. Then we begin to intervene. So eat healthy, eat your fruits, eat your vegetables, exercise. Know how to conduct your pelvic floor exercise. Be mindful of your sexual partners because the cervix is the bridge to your womb. So from the vagina to the womb, it's just the junction, it's the toll gate. So if you expose yourself to a couple of infections, if you expose yourself to sexually transmitted infections, urinary tract infections, or if you're not keeping your hygiene properly, or if you used to put foreign things into your vagina, then you might likely be in trouble. So it's a risk factor. So generally important regarding the strength of the cervix, it's your lifestyle modification. Eat right, exercise, do your Kegel exercise, then you will strengthen the pelvic floor muscles, including the cervical muscles. Okay, I love that question. Will a woman's sitting position change after Cycloads? Not at all. Once we have successfully placed the sutures, placed the Cycloads, just observe the precautionary measures we gave you. No sex, no sports, no stress for 10 days. You can sit anyhow you want to sit. Of course, remember, no sports means go easy. So if you did your cervical cerclage today, when you get home, forget the dishes. Forget whatever. Just go and stay in one place and relax because possibility you're going to spot is very high. Possibility you're going to have little discharge and pain here and there is very high. So there is no particular position you can sit at. Okay, you can sit at any position, but please observe the 10 days before and 10 days after. Zero sex, zero sports, and zero stress. 3 S's: sex, sports, stress. Okay? Can a cervical cerclage simply fall out? No, if it's properly put in place, it's not supposed to fall out. It's a suture. Now, previously, there are 2 types of sutures. So sutures are like the material we use in doing the surgery. There are some sutures that are absorbable sutures. So once we put them, we don't have a need to go and remove them. Lately, that's actually what newer practices are using. Like if we are putting cervical cerclage from their intra-abdominal cells, we're not going to open the abdomen to begin to remove them. But when we're going through the vaginal route, we might go in there and remove. So the sutures we can remove are the removable sutures, the non-absorbable sutures. The absorbable sutures will be absorbed into your body. So we wouldn't have a need to go and remove them. So if the sutures are placed properly, no need of it falling out. I love that question, Kenneth. Beautiful question. Guys, still ask your questions. And please, if today is the first day of attending my clinic, I show up every Saturdays about this time. Please make sure you subscribe. Make sure you join the community. Make sure you check the other videos, other important videos. Now, we have a special privilege for people in our community. So there's an exclusive club you can join. So you can click on the join icon, then you decide if you're going to be in light, if you're going to be in classic, if you're going to be in prime. It's going to help you a lot. Our aim in this group is to use knowledge to defeat infertility, to defeat all the problems out there. So please come join us. Now, if you're in our Facebook, make sure you're in our page. Make sure you're in our group. Make sure you're in my timeline. Anywhere you have social media, we're there. But please be someone that will practice what you learn every day. Okay? If you have any other question, please go ahead and ask. Hi, Doc. Good evening. How are you? I'm good. Is it that sex and sports dislodges the sutures? Now, a couple of things can happen when you actually expose yourself to sex and sports. So when you engage in sex about that acute phase, you have the sutures. The possibility you can, disrupt the healing process is high. So bleeding can happen. The sutures can break down because at that acute phase, within that 10 days, the sutures are not in place. They are still friable, they are still loose. So the idea is to allow the sutures to bind the cervix together. So besides dislodging the sutures, leading to bleeding, infection can also be introduced. Okay, so the idea is to be precautionary. So it's not like, oh, once you do it, it's going to dislodge it. But it can lead to bleeding, it can delay the healing process, it can introduce infection. Okay, so that's the reason. I love those questions, can I? Okay, if a woman goes into labor and the cerclage is not removed on time, can that cause any damage to the womb? No. When you go into labor, when you go into premature labor, it's an emergency. Hopefully, when you go into premature labor and you're tending towards 37 weeks, then we will be hopeful that the baby is going to be fine. So once you go into unplanned labor, so unplanned labor means before 37 weeks, you go into labor. We're going to keep an eye on the best way to deliver the baby. So at that stage, definitely we're going to quickly remove the sutures and deliver your baby. So yes, no damages to the womb. Once the life of the baby is compromised, our main aim is to deliver the baby, hand the baby over to the neonatal intensive care unit, make sure the mother is good, then we hope for the best. So any woman that is pregnant and you happen to go into labor before 37 weeks, it's called preterm labor. We need to deliver the baby carefully, place the baby in neonatal intensive care unit. Neonatal intensive care unit is a special place that babies that are born before 37 weeks are kept, so they will be better before we send them home. I love those questions. Beautiful session we've had today. So if you still have your questions, please feel free to ask. In the next 2 minutes, we're going to transition to our Facebook. We have an open clinic, an impromptu open clinic for all our members to bring you up to speed what we are planning for the month of June. So that for the month of June, in our organization's Nospirations, we are going to focus on long-term infertility. How can we defeat long-term infertility? So that will be the focus in June. So plan ahead. It's going to be on the 26th. But after this clinic, immediately after this clinic, I'm going to transition to our Facebook page so you can catch up with me there, and I'll run an open clinic for 30 minutes. Okay? If you want to talk to me, very possible. All you need to do is to follow us, subscribe. You can come in for 1 week, 1 month, 3 months, 6 months. And if you're already pregnant, you can also come in and we can look after you and your baby until you deliver your baby. Okay? All right. In next 1 minute, I'm going to round up. Please remember to share this video with any pregnant woman. Remember to share this video with anybody you genuinely want to see the best in. Invite them to come and join us. Subscribe. Keep showing up every day. There is one particular lady that has shown up for all our clinics. COO, you can identify her. Olutosin, amazing lady. She's been in all the clinics. I hope we are helping you understand your body better. Is Cerclage same as tying the womb as a form? No. Cerclage is done in the cervix. Tying, there is actually nothing like tying the womb anyway. Okay? You don't tie the womb. You tie the tubes. You tie the cervix to prevent pregnancy from escaping. You tie the tubes. It's called bilateral tubal ligation to stop pregnancy. When you tie the tubes, the eggs cannot come in, the sperm cannot come in, pregnancy will not happen. So they are entirely two different things. There is nothing like tying the womb. You can't tie the womb. Okay? I think I have another. Is there any contraindication for cervical cerclage? Unfortunately, one known contraindication. If you're having multiple pregnancy, unfortunately. So women that have unstable cervix, cervical incompetence, cervical insufficiency, and they're expecting more than one baby, well, we just, trust God and do the best we can. We still go, some providers still go ahead and use Cerclage. So that's one of the, contraindications for doing this. But generally, nothing really stands out that will prevent you from doing it. The benefits from giving cervical cerclage far much outweighs the risk. Okay? All right. Another question, please. What can you call this infection? It appears under the person's tummy, something like eczema, red. Likely you have a fungal infection. What you're describing is likely fungal infection. Eczema is a fungal infection. So what you need to do, go to your doctor. Let's take a good look at it. You might just give you a topical cream and you'll be fine. We are candidates of 2 successful Cerclage. Look at that. Oluwatosin, she's actually had 2 Cerclage after 2 losses before 20 weeks. Solid, wise lady. 2 successful Cerclages after 2 miscarriages at 20 weeks. It's painful to become pregnant. You've named your babies, you've decorated their rooms, you've had plans, then at 20 weeks you lose them. Very, very painful. So I'm happy, my dear, that you had your babies afterwards. Okay? So 2 miscarriages, but 2 successful outcomes. So you have 2 kids now. All right, guys, my time is up. Thank you for coming. My next clinic will be on Tuesday. Tuesday will be 6 p.m. Eastern Time, 11 p.m. Nigerian. Saturdays, 12 p.m. Eastern Time, 5 p.m. Nigerian. Join me on Tuesday, but right now I'm transitioning to our Facebook for another open clinic. So if you're in our Facebook page, if you're in our Facebook group, if you're in my timeline, please join me in my Facebook. Then tomorrow is also another opportunity. Tomorrow you're going to learn about molar pregnancy in our maternal and child health clinic. So join me tomorrow. But right now, transition to Facebook and join our page. And I will see you guys straight on. God bless you. I want to thank my COO, amazing lady. I want to thank Dr. Ndiche. I want to thank Tosin. I want to thank Chinyere for showing up and asking those important questions. Enjoy the rest of your evening, and I'll see you in a few minutes. Bye-bye for now.